The chronic Lyme disease advocates wanted to see him get behind their view of the disease, and he wouldn't do it because the science didn't support it. For that, they came after him. He went from being the sort of medical hero to being what some patient advocacy groups labeled the Antichrist. His university ended up having to use bomb detection technology on packages. He had to have extensive security systems installed in his lab. When he made public appearances, he would get death threats. For people like him who are in the public eye, that's not entirely atypical. I get interesting threats on my blog when I write about Lyme disease. It tends to be people who are suffering who write in and say, you should suffer like me and then see what you think.
Everyone involved in the Lyme debate in the UK says they don't want that to happen here. But there's increasing pressure from patients for their preferred treatment. I travelled to Aberdeen to meet Nicola Seal and find out more about her and her illness and her struggle to get what she says is the correct treatment.
My job as an ecologist involves sampling and monitoring rivers and lochs, checking to see if there's pollution and if, the ecosystem's as it should be.
On the banks of the River Don near her home, Nicola began to tell me how her life had been before the illness.
A river like this, I'd wade in and catch all the bugs and beasties that are living in the gravel. So I can sit there with a toothbrush and pick up the rocks and scrape the algae off, looking a bit insane, and take those back to the lab and identify those. And they're very good indicators of the quality of the water. It's brilliant, actually. Really enjoy it. It's a brilliant job. You get to be out and about in beautiful places. So this is my outdoor cupboard. Got twin ropes for climbing, helmets, harnesses. These are all my carabiners and protection and various slings and things. Walking sticks, ice axes here for winter climbing, crampons. I was really active before I had the Lyme disease. I was Munro bagging and doing quite a bit of mountain biking and rock climbing on the sea cliffs in Aberdeen and doing quite a lot, really. So now, I haven't been climbing for 2 years outside. I haven't been up on Munro for 2 years either. Done little hill walks or sort of like tame, sort of noddy type of walks. But I'm currently not doing field work because I had a relapse from doing field work in September.
So the illness has had a major effect on Nicola's life. It's also had a big impact on her partner, John Hunter.
I met Nicola 5 years ago on the west coast of Scotland, and we'd both spent the day winter mountaineering. Quite a hard, difficult activity. Contrast that to sometimes when Nicola was basically breathing and existing. To have to carry a partner who's only mid-30s up the stairs, is quite a stark contrast.
The first sign that she was ill was 11 days after she came back from her holiday on Rum.
I had a sudden headache and then I had really bad stomach pains and my knees were really sore. And I felt kind of flu-y, and the GP thought that it wasn't flu. He phoned up the hospital, and they said, come in the next day. Yeah, by the time I got to hospital, I couldn't hardly walk at all.
After hospital treatment, Nicola was sent home with a course of antibiotics. When she failed to improve, she was given a second course. The drugs helped, but when she came off them, her condition worsened again. Most worrying, she says, was what doctors told her next.
The neurologist said, we think it's a software problem. And I was like, OK, so you think I'm crazy? And they suggested I go and see a psychologist. I knew I wasn't crazy. I knew I wasn't making this up. I didn't want to be hobbling around the shops, hobbling up and down some hospital ward. I was quite angry, really, that they called me crazy. But I went to this psychology appointment. And the psychologist sort of agreed and said I had no psychological issues.
She became convinced that she had chronic or long-term Lyme disease. Nicola went to the private Breakspear Hospital in Hemel Hempstead, where she was diagnosed with Lyme and put on a long-term course of antibiotics.
We've paid about £12,000–13,000 so far. I was quite angry to have to pay all that, really. Goodness knows what would happen if I hadn't have had the means to pay for this treatment. My friends and family helped me out, but not everyone's got £13,000 to pay for medical treatment, have they?
But at the heart of the debate over Lyme is the conventional view, shared by most NHS consultants, that long-term drug therapy is the wrong course of action for those who still have serious problems after treatment for Lyme infection. Andrew Seaton, the infectious disease consultant at Gartnavel, is adamant that long-term antibiotics shouldn't be provided
Antibiotics are not without side effects. We are looking more and more on restricting antibiotic use because of the adverse effects they have. This might be symptoms such as diarrhea, nausea, vomiting, skin rashes, but also more serious complications like Clostridium difficile and other healthcare associated infections. They can also affect bone marrow, they can affect liver. The alternative is taking a more holistic view of the patient, thinking about other psychological measures like cognitive behavioural therapy.
And he says there are good scientific reasons for not giving the drugs.
There has been a clinical trial in the United States which looked at patients who had confirmed Lyme infection and then they had post-Lyme complications with fatigue, poor concentration, general non-specific symptoms. And in this clinical trial, people were treated with further parenteral antibiotic therapy and there was no clinical benefit. I don't think anybody is denying people who've had proven Lyme disease didn't have it, but the aftermath will not be improved with antibiotic therapy. So you miss the point. This is a result of the infection rather than as a direct consequence or follow-on.
Nicola was treated initially at the Aberdeen Royal Infirmary. An NHS Grampian gave me this statement.
The treatment of Lyme disease provided by NHS Grampian follows the agreed national guidelines for the management of this condition. This patient was treated according to these guidelines. The guidelines that were in use in 2008 state that, to date, there is no convincing biologic evidence for the existence of symptomatic chronic B. Burgdorferi infection among patients after receipt of recommended treatment regimes for Lyme disease. For that reason, long-term antibiotics for Lyme disease are not recommended in the national guidelines followed by Scottish infectious disease physicians and may well lead to adverse events.
Stella Hewish-Shires of Lyme Disease Action caught Lyme 10 years ago. She's had her own struggle to get long-term treatment. She says the guidelines themselves mean patients take risks.
If they are denied diagnosis, you can't really expect them to sit down and just let a debilitating disease wreck their lives. So they're going to search for help. They're going to try and find it some way. And they will try and buy antibiotics over the internet if that's what they feel will cure them. The dangers of buying unregulated, improperly manufactured drugs are well known. But patients are not always in a position really to assess that risk. And they try and balance, well, I'm having no treatment and I'm getting worse, with, well, here's a possibility that a drug that I can buy might help.
She believes that to avoid Lyme wars here, more studies are necessary.
We need a proper review of the available research, and we then need more research. We could also do with some research into improved tests. And we could certainly do with a much better acknowledgement within the NHS that the tests are not 100% accurate.
Dr Ho Yen agrees that better testing is essential to clear up doubts in some Lyme cases and to try to avoid serious conflict.
I certainly hope that if we can develop better diagnostic techniques and methods, we will be able to find a middle ground on how best to manage patients with Lyme borreliosis.
But Dr Ho Yen and Dr Seaton believe different causes lie behind long-term Lyme-related illness.
Lyme is a cause of chronic fatigue syndrome, or ME. It is a small cause, it's not a major cause. Whatever title or label you put on it, you will still have to do one thing, and that is give the patient appropriate management so the patient gets better.
The post-Lyme symptoms are akin in many ways to the symptoms of chronic fatigue syndrome, which we see following on from many other conditions. So we do know from chronic fatigue syndrome that cognitive behavioural therapy is beneficial to patients. The other thing is graded exercise or graduated exercise programs to help in the rehabilitation of patients. So perhaps clinical trials that look more at the rehabilitative aspects and the behavioural aspects would be most welcome.
Nicola Seal, meanwhile, has lost a chunk of her life to a mysterious and debilitating illness. So how does she feel now about what happened to her?
I could have ended up in a wheelchair if I hadn't have been so persistent and fought my case and looked into it and done my own research and then got prompt private treatment. I feel anger against the system and the system of having to adhere so closely to these guidelines, because I could have been really seriously, permanently damaged by this.